I'm Adam Salati with the eClinicalWorks podcast, and if you're watching this, you're probably the type of person who likes to keep up to date with all sorts of relevant information. But did you know that eClinicalWorks offers CME CE credits for attending live webinars at my.eclinicalworks.com? It's true. And you can earn credits for physicians, billers, and office staff on over 30 topics on our site. Just look for the CME CE icon on my.eclinicalworks.com and sign up. eClinicalWorks has been around for nearly 2 decades at this point, and from its early beginnings, it has grown and evolved ever since. But it's also nice to know that our users take that journey with us. And to speak with me about that today is Josie Van Scholten from River Road Medical Group in Eugene, Oregon. Josie, thanks so much for being here today.
Thank you. My pleasure.
So before we get started, why don't you tell us a little bit about River Road and who you guys are?
Yes. River Road has actually been here since 1961. We're one of the oldest family practice clinics here in Eugene. And we've been using eClinicalWorks for about 10 years. And like I said, we're a family practice, so we see, babies on up. And currently we have 5 providers and 19 staff, and I'm, like you said, the administrator.
So we led off speaking about how your experience grows the longer you use the product. You said you've been using the product for quite a few years. 2007, I think, is when you went live. So what do you think is the difference between a user and a super user?
For me, I would define those terms as a user as someone who simply uses the computer to get a job done. They know one piece of it. This is my job. This is my task. I don't need to know any more, any less, which is fine. I would say a super user is someone who is looking at it more globally, that they want to know the ins and outs. They want to be looking at how can I use this tool to make what I do more efficient, learn any tips or tricks to make it quicker and easier. And I guess by that definition, I would have to say that I'm a super user, because that's what I've been doing a lot in the last 10 years.
Well, I was going to say that's why we're here talking to
Yeah.
you. Probably a good indication, right? So let's talk about, as a super user, what are you doing really well right now, and maybe what are you working on?
I think River Road Medical Group has gotten very good at using eClinicalWorks dashboards and products to achieve quality bonus funds. Our Medicaid program here in our county, our CCO, has had a bonus pool for the last 5 years. And we also participate in the Medicare PQRS, as well as some commercial Medicare Advantage plans have started offering quality bonus pools as well for meeting measures and closing care gaps. And so things like the HEDIS dashboard, the PQRS dashboard, all those are very valuable to us. And one piece is kind of drilling down to the patient and figuring out who those patients are and contacting them. Another piece is figuring out how the computer works and making sure that you document appropriately in a structured manner, that you get credit for the work that you're doing. Some things I think we're working on, I would say, unfortunately, with commercial plans, I feel like reimbursement is still kind of lagging. I feel like we're pretty small and nimble and have made a lot of changes, but I feel like insurance companies are still negotiating kind of based off, who can provide them with the biggest panel rather than on quality, but I'm hoping that will continue to evolve as well. I think another thing that would be helpful to see over time is just, unfortunately, there's a lot of different standards that one program may use one screening tool and another may use another, and so that's a challenge we're working on as well.
Right, there's almost no standard to the standards.
No,
right? Everyone has
right.
their own, and you mentioned the HEDIS dashboard, and I know we support over 250 different quality measures, and a lot of them are kind of shades of the same thing sometimes. So
yes,
it can be confusing and difficult. And I think you mentioned when we were speaking before that you were meeting the measure one type of the measure, but not meeting another type of the measure just because of that little shade of difference that
right.
That
and that was the BMI. We weren't meeting it, and I thought, how can that be possible? Because I know we take a height and weight on every single patient that comes in, and yet PQRS had a BMI range set one way, and our Medicaid had it set a different way. So it was helpful to have my eClinicalWorks project manager that I could call and say, what's going on with this? And she was able to look in our system and find that difference and reset it for us.
Right. And of course, the HEDIS dashboards and the other dashboards that you mentioned helped you to even, identify that problem in the first place. And like you said at the beginning, because, otherwise maybe you'd be waiting on that data to come from the payer all the way at the end of the game. And
it would be too late. Exactly.
Right.
Yeah.
So what types of, let's talk about your scores. Where do you kind of rank in terms of your peers, in terms of those quality scores, now that you have all that information?
I think for our Medicaid program in 2014, we were the only family practice clinic in our CCO to meet all 12 measures. We were pretty proud of that. As far as the Medicare ones, I think, usually when we talk to them, they're impressed with the number of care gaps that we've closed. I think for Regents, I think we've met like 75% of them. I know for United Healthcare, I think we met the benchmark to get 60% of our patients in for a Medicare wellness visit in the first 6 months. So,
what changes have you seen as a result of those high quality scores?
At first, I think that there is, unfortunately, just a part of it that's kind of checking boxes to begin with, that until you get all the data in there, it's not really useful until it's in a structured format and you can start looking at the reports. Now I feel like that we've kind of gone through this evolution of figuring out how to put the data in a usable format and meet these measures. Now I feel like we're just now getting to the exciting part where we can really look at how can we really improve patient outcomes and meet individual patient needs.
Would you say that laying that groundwork really was pivotal to being able to get to where you are now?
Absolutely. And I would encourage all clinics it's okay to take it slow, to take off bits and pieces. I just look for opportunities. Let's start with flu shots. Let's start with something simple. It doesn't have to be an all or nothing.
So a lot of emphasis these days is being placed on the patient and the patient's role in the care team, and trying to put more responsibility on them and involve them in the decision making. Let's talk about your experiences with that. Now, while some offices might be a little bit uncertain about how that might work, your office seems to have just jumped right in.
Again, we had an opportunity to participate in a grant through the Rural Oregon Health Initiative on shared decision making, and I signed up because I like any opportunity to collaborate with other clinics, and so that I'm not the only person reinventing the wheel, that we're all kind of working together towards the same common goals. And through that process, I can't say that I knew a lot about shared decision making when I started it, but once I was in it, I started thinking about our colonoscopy rates, because that had been a measure that I felt like we really weren't meeting. I felt like my nursing staff was pulling their hair out, that they would approach a patient and they would get a really negative response that the patient had no intention of doing that. Or the alternative, they would say, oh, sure, yep, we're going to do that. And we'd create the order and we'd do the referral, and the patient would never follow through. So you create all this work for no improvement in outcome. And I just felt like I couldn't see how we were ever going to get there. And through that process, I kind of realized that we were always approaching a patient with, you need to get your colonoscopy. You're due for your colonoscopy. And that telling people what to do isn't always the most effective strategy to get buy-in. And so using our HealthWise education piece that's within eClinicalWorks, we were able to find a information sheet, and we started approaching patients by saying, colon cancer kills, it is preventable. Let's talk about screening options and which one is right for you. And here's some information. And I think it made a huge difference. In 2014, our compliance rate was 27%, and by the end of 2015, it was up to 35%. So
it's an improvement.
I think it's pretty powerful that if you let it be the person's choice, their idea, you get more buy-in.
True, and you're starting out with that choice as opposed to starting out with the that being forced to into compliance, which you're right. It sounds like it would get on people's bad side sometimes. So speaking of communication, that obviously involves a lot of changing the way that you talk to the patient. Do you utilize any of the other eClinicalWorks tools to enhance your patient communication?
Absolutely. We were, I think, kind of early adopters. Oregon has its own medical home program, and to do that, you needed to sign patients up for the patient portal. So, it's not easy. It takes work. We had to, we approached patients when they would check in and offer it. We would get high school or college students to volunteer and offer to show patients how to use it while they were sitting in the waiting room or answer questions. But now we have about 65% of our patients signed up. And really, once you hit that critical mass, it becomes a really powerful tool, I think, for engaging patients and helping educate them. There's so much in primary care that goes on behind the scenes that I think patients aren't aware. They get anxious that, they're not doing anything when really, we're waiting on the insurance company to get that, prior authorization or whatnot. And so we've started, after we send a referral, sending a message out to a patient, letting them know your referral has been submitted to your insurance company. Please allow this many weeks for it to be processed. And I feel like that really cuts down on the phone calls of coming in, of people being worried and not knowing how it works. And I think it builds trust that they know that we are still working on their behalf.
So we covered a lot of stuff there. I just want to recap for the people who are listening or watching that you, number one, signed up 65% or more of your patients on the patient portal.
And it wasn't overnight, but it
took some time to process, but you're there. And that you realized that there was an issue. They started to maybe have some misconceptions about what you were doing, especially with regards to referral process, but that you used the patient portal messaging, or maybe I don't know if you use the clinical messenger to send out phone calls and text reminders to tell them what was going on in that process to make them more informed and more involved.
Yes.
And you found that was beneficial.
And I think my staff really likes the messenger piece because it's a lot quicker and easier than making a phone call and trying to track someone down.
Hi, how are you?
Right.
That's good. Right. Oh, yeah. And then we get to the thing, right?
Yep.
Right. So it cuts that out. I'm sure it makes it much more efficient without being less
Or you don't have to leave a
personal.
Message or wait for them to call back, that it's done and off your list at that point.
Great to hear. So let's, and you mentioned another really interesting thing there where you said you brought in some students to help you with the patient education. Talk to us a little bit more about what you did there.
Well, being in a college town, we're blessed with students who are looking for volunteer hours. And so we had asked some of them to sit in the waiting room and approach patients to see if they needed help or if they had questions or if they could show them how it works. I think sometimes people need to see, what all it can do and what the benefits are before they're willing to try it. And so, it worked out well.
I think that's just a really interesting concept because, we're always looking to keep costs low. But this, I think, was a great way to do it. And it's kind of thinking, physician extenders doesn't just have like a title at the end of it, like the little the PA or RN or whatever it is. It can also maybe be people in the community who can work together to help each other. Been to an eClinicalWorks Days event? If not, you're in luck. During 2017, the eClinicalWorks Days team will be visiting 62 cities across the country. Each event offers a main classroom agenda, as well as other specialized sessions to provide you with a whole day of learning. And if hands-on is more your learning style, we offer 20-minute one-on-one sessions with specialists from our EMR, billing, and EBO teams. And it's all available at no cost to you. If you're interested in attending one of these events or want to see when we'll be in a city near you, please go to www.eclinicalworks.com/eClinicalWorksDay. We hope to see you there. You think, so you're using the patient portal a lot, you're using Messenger a lot. If you weren't using these tools, what do you think would be different? Is there any kind of a risk involved there?
Yes, as the HIPAA compliance officer, I get to maintain our disclosure log, that anytime there's an inadvertent disclosure, we have to keep track of it and make sure the patient is aware of it. And our top disclosure is that when we mail out lab results, it seems like once or twice a year, either somebody, doesn't realize that it's a 2-page result, or they accidentally grab the page that's behind it and the lab results get mailed to the wrong patient. And so whenever I call them and tell them that this has happened, I always make a pitch for the portal that, you could receive these electronically and then you wouldn't have to worry about this.
Right. And I've seen the signs up around your office too, saying, we can send you text messages, you could get this on the portal. So I'm sure that helps get the word out and put that in their mind that it's there and available. Now, portal capabilities are evolving all the time. And one of the newest capabilities, and I think one of the most anxiety-inducing aspects of it now, is the ability to put your schedule, the physician's schedule, online so that patients can book it. In our system, that's Hilo, right? But you, again, are starting to use that as well and not shying away from it. Tell us about that.
Okay. Well, again, as a small clinic, it can be difficult to differentiate yourself against the larger multi-specialty groups. We don't have the marketing budget that everyone else has. And I was sitting at a lunch group of other moms that we get together monthly for kind of birthdays and socialization. And they were all talking about this hairdresser that they loved that did appointments online, and because they hated the back and forth and it was so difficult to even find a time to begin with, they like to be able to just pick the one that worked for them. And I was really thinking that would be a great way for us to differentiate ourselves. We're blessed with a lot of really long time patients since we've been here for so long, but you always need to keep new patients and new families coming in. And so we had a new PA starting, and because she didn't know any better, I just asked her to sign up, and she said, okay. So we started with her. And then, when her whole schedule didn't fall apart, her whole day didn't get, messed up, Dr. Buchanan, our owner, she agreed to try. And she's actually found that she has a 75-year-old patient that schedules all her appointments online. So
it's not just the young kids. It's the old elderly patients as well. They're not afraid of it. That's good to know. And I think that's a really creative way to use that. You got the new person coming on. They don't have a schedule to disrupt. Let's build it with Hilo, and it sounds like that worked out really well for you.
Absolutely. And again, it doesn't have to be all or one. We still have 2 providers that don't use it, and that's okay. They can be incremental, your growth and your journey.
Yeah, as you said, change is it sounds like change is a matter of taking smaller steps as opposed to, I think a lot of times we try to encourage people to do a lot at once because we're very excited about it.
Right.
But it sounds like it can be more successful if you do a little bit, manageable bits at a time.
Right.
So the Hilo thing in the appointment scheduling, how do patients even know that that's available for you?
We are trying to, existing patients that are coming in for the providers that are participating, letting them know, hey, do you know we schedule appointments online? And most of them are like, oh no, wow, that's great. Just go to our website. We also have started experimenting with Google Ads. And it's pretty amazing to me that, 5 clicks, somebody's searching with a symptom, our ad pops up, you click on that, it goes to our website, there's the Hilo widget, they click on that, pick your provider, pick your appointment time, and you're done.
And that seems like very fast process, especially for a audience that's probably counting clicks every day.
Right. No kidding.
5 clicks to a new appointment for your patient.
Right.
For something that you said they were looking up probably a symptom or something like that.
Right. Yeah. That's how we've set our ads. Yeah. To come up for.
That's a great usage of that.
Yeah.
And you also mentioned another important piece, that the widget is on your website. So it integrates directly there, and they can book their appointment accordingly. With all of these projects that you've put into place, and we've only mentioned some of them here today, how has eClinicalWorks helped to support those efforts along the way?
I think they've been very helpful. Usually you're assigned a project manager for any new product, and that person is just a resource for you to call and ask any questions. In some cases, they'll call you and check in and see how things are going and make sure you're following up with stuff. But in general, I found them to be very useful. especially in the quality programs. I feel like I wear many hats as a small clinic administrator, HR, finance. It's all me. So I don't know that I would have the time to do all the research on those projects, on those quality programs, and to be able to just call one person and ask the questions of, wait, does this count? Does this not count? Has been invaluable.
And what about your strategic account manager?
Oh, Hammond, yeah, we're tight. It's really great. Even, if I'm frustrated with something kind of stalling, or I don't understand if something's working, or maybe I have a question. We went to the conference and we learned about attribution lists, because one of the ways we're struggling to meet our quality programs are the patients that don't come in, that they've picked us as a primary care and we have no idea. They're not in our system. We don't know who they are. So they don't show up on our dashboard. And so he was helping me find who would be the proper person to talk to start working with insurance groups to get lists of our patients as these attribution lists that we can import them into our system and start using them on our dashboards.
So, because this is probably something that other people are thinking about as well, and
it's like coming soon. Yeah,
your plan is to you found people at the insurance companies that you're going to contact proactively and say who's attributed to us, all the insurances that you contract with, and get them to send you a list, and then you can maybe use something to reach out to those patients.
Absolutely, yeah. Contact them to either come in for their Medicare wellness visit or what other, even just to meet them and make sure that they're meeting all their quality measures, and see how their overall health is, and develop a starting point.
So let's ask this question as we try to wrap up, because I think there's been a lot of good stuff here so far. But as a super user, what do you want to tell other people? What do you think? What's one or two things that you think that they might benefit from?
So one of the tools that we found to be very helpful is the Medicare wellness visit and meeting the quality programs, because it is such a comprehensive visit in terms of documentation. And we have found that providers don't love those visits because it's a lot of documentation. And so we have actually started using medical assistants and billing incident too that have a little more time. It frees up providers to see actual chronic care issues, immediate issues, but that the medical assistant can get in there and get all that information to be ready for the provider, and to kind of give us a starting point for where we're going to start helping them achieve their health goals.
So get those Medicare wellness visits
Absolutely.
done. Use your PAs.
Yep.
And set up some templates and make it easy on yourselves and your
Yes, the
providers.
templates definitely make it easier and are good reminders as you're trying to get through and get all those boxes checked.
Well, Josie, I think this has been a fantastically informative podcast. Thank you so much for all of your time and your insight. For the eClinicalWorks podcast, I'm Adam Salati, and you can check out our other episodes on YouTube, iTunes, or my.eclinicalworks.com. Thanks for watching.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.